on this Tech Health and Wellness show, we will be speaking on chiropractic care. With me today is Dr. Matt Khan, founder, senior consultant, and CEO of Chiropractic First Group of Clinics. Welcome to the show, Matt.
Hi, everyone.
Matt, give us an overview of the chiropractic profession.
Chiropractic in Malaysia probably started in the 1990s. During the 90s and the first, 2000, it was a lot of education was required to educate people. Nobody heard about what chiropractic is, right? And they will always think of us as the Western Theta. That means, right, the so-called, instead of Eastern Theta, the Western one, the educated Theta, right? So if you were to have back pain, neck pain, headache, migraine, or you have a sports injury, right? And you have, accident, you will go and see a chiropractor, okay? And of course, they will always say, oh, you go there, you get a nice crack, right? So they always link chiropractors with having a crack. In late 2000, right? That's when local IMU Institute, IMU started a local program in the medical program, started a program in chiropractic. Okay, and they've been producing local graduates. Yeah.
We hear lots of misconceptions surrounding chiropractic practice. Can you name a few?
Of course, the first misconception is that chiropractors do not have education, do not have training, and that's far from the truth. People always mix bone setting with chiropractic, and they always use it interchangeably. And some bone setters will call themselves chiropractors, which is very wrong. Okay, and I think the Chiropractic Association should take more public education on this to make sure that they identify the education of chiropractors and the safety of chiropractic. Okay. Another misconception is they were scared that you get adjust, you click clap, it's very dangerous. It's not. If it's done under a doctor who's well trained and prepared, okay, and especially so when you're dealing with the spine and where the nerves are, make sure you go to a practitioner that looked at the X-ray and see it. Okay. Of course, there are cases where injuries, right. If you don't have if you do not have an X-ray to see what's going on, right, you do not know what you are adjusting underneath. A patient may be born with anomaly, may be born with a tumor, or may have a tumor, may have different structure, and may have fracture, may have a lot of different things underneath, and you do not want to push and twist the bone, right, without knowing it.
The X-rays can be done at the clinics?
Most of the X-ray will be done in the X-ray center, right? Where we send the patient so that usually I don't think most of the chiropractic clinics have X-rays because it takes a lot to invest in it, as well as you need to have a radiotech, a radiologist, and a lot of compliance technically issues, right, with the ministry. So we will send it to a hospital or medical centers where they maintain the X-ray and the quality of X-ray, right? And they will produce it, and they will work with chiropractic clinics where once they produce it, they'll send it digitally or with the films being sent in. Okay, and how do they take the X-ray? What kind of positioning would have been trained and conveyed to the X-ray center?
Dr. Khan, on the internet, we see lots of videos of chiropractors cracking bones. Is this the normal practice actually?
Number one, I believe the association do not encourage this at all. Okay, as a profession, professionals, we don't encourage this. And yes, we can go into online and say, hey, look, this is what chiropractic can do, this is what chiropractic help. Let's do some interview with the patient, okay? And this is how we can adjust you, okay, with after this evaluation, right? And that is proper, because a lot of people will think that, all I need is go there, have a big click clap, and my problem is resolved. And that's far from the truth. Okay, you need proper examination, X-ray, right, evaluation to see that what's going on, okay, and what is safe to do, what is not safe to do.
Do patients feel the pain during the treatment?
Okay, if it's done the right way, okay, the right angle. Now, when we are adjusting, we are not twisting. We are adjusting what is twisted out or what is misaligned. Okay, so when it's misaligned, we are returning it back to its motion, returning back to its position. Okay, and sometimes it's not pop in and pop out. A lot of people think it's pop in, pop out. Okay, we are realigning and remodeling, just like dental work, we're realigning it. Okay, so if you are doing it the right way, right, you should feel relief more than pain. Okay, right. So majority of the time there shouldn't be a pain, but of course, if you have a practitioner that did not do a proper evaluation or did not do X-ray, then it will be based on guesswork, and possibly you may elicit some pain there. Okay, right. But even having said that, have we had normal adjusting that maybe fracture ribs for elderly ladies, right? And yes, that's possible for practitioners that have lacked that experience, right? So knowing how to adjust an 80-year-old lady, okay, with a fragile, right, osteoporotic bone, okay, what to do, what are the procedure, what are the techniques that we use, what are the gadgets we can use instead of just pushing it down. That's important. So that comes with training, that's come with experience. But of course, most of the schools, most of the university will have taught all the doctors how to prevent injuries in a normal, right, normal daily consultation or daily adjustment. Okay, right? Yeah. So it shouldn't. Okay, if there should be, then something may go wrong. But of course, we document it. And then sometimes, okay, our evaluation may be, okay, I evaluate that, I adjust that, and the patient, after that, I feel a little more stiff. Then I evaluate, it actually should be the other way around. And then we adjusted that. So being adjustment is a manual therapy, manual manipulation. So there is, right, what we call, there is what we call artwork. So it's an art form too. Okay, so it's like surgery. A surgeon, I can be technically trained, but I also need to have the art form. I need to have the skill set that develop over time. Okay, so some surgeon can just cut beautifully. Some surgeon cut a bit rough. So experience do matter.
Okay, Dr. Kat, can you share with us what are muscular skeletal disorders?
Musculoskeletal disorder, just the definition itself says that it is about muscle and bones, it's the skeletal system, right? So in general, literally will be low back pain is a musculoskeletal problem. Knee pain, joint pain, restricted motion is also a musculoskeletal, right? And musculoskeletal, because of muscle, you can have, yes, frozen shoulder where you have injured and tear the tendon of the muscles, right? To badminton injuries, you twist your ankle, right? An ankle, a tear of the ligament is also considered musculoskeletal, right? So anytime you have injured the low back, when you carry too heavy, you fell down, right? You do something that is not supposed to do, okay? Improper carrying, sports injury, and especially nowadays, prolonged sitting in the bed ergonomics, right? You will get, right, your joints of your vertebra, right, into trouble, and that is put into category as musculoskeletal. Okay, yeah, and sometimes the musculoskeletal may develop into because it's not corrected over time, it will degenerate and develop into other problems. Okay, especially when it touches the nerve. Now you have neurological issues. Now you get headache, migraine, right? Gastric reflux, right? I've got a patient that tells me, ever since I've been adjusted, I've been going to toilet regularly. Right? I used to be constipated. I go to toilet once every 1-2 weeks, and now after you adjusted, clear my low back pain, right? I've been going to toilet every single day, right? So a musculoskeletal problem that developed into, right, neurological issues. Yeah, I've got also patients who are young, 14, 15 years old, still bedwetting every day, right? Brought to us, okay, and we check, yes, musculoskeletal problems in the spine, right? Compressing, there was some compression on the nerve, right? Okay, after we adjust it, problem resolved. Yeah.
So is it curable?
Is it curable? Most of the time is if it's been right attended to at an early stage. But unfortunately, okay, a lot of us, right, tend to ignore it. You know? So what we call the misalignment of the spine. Okay, you have early signs and mid signs and late signs. Okay, right. Early signs would be stiffness, tightness, achiness. When I sit a bit long, I feel stiff and tight. So they'll go stretching, they put oil, right, salumpas, right? They do right a lot of ointment and so on. So they tend to ignore it, ignore it, and ignore it. But unfortunately, they didn't understand that, hey, our spine is always under constant loading, carrying 2/3 of our body weight.
Okay.
Right? So if you are, just say you are 60 kilo, right? 2/3 of body weight is about 40 kilo. 40 kilo is like carrying 4 bags of 10 kilo rice. Every morning when you wake up in the morning, it's like 4 bags or 3 to 4 bags of rice on your shoulder, and that's the weight collapsing on your spine. Okay, and if you have an injury there, right? Injury when you carry something, or sports injury or badminton injury that you did not take care of it, it will grind and rub, right? So the first instant you feel every morning you wake up stiff, tight, sitting on the table on the computer, right, for about 10, 20 minutes, you need to move around and stretch because you feel stiff and tight. These are called early signs. And you still don't take care of it, it will start to degenerate. The disc will start to wear off abnormally, it will start to dry off, and then it may present itself as a slip disc. Okay, right? And then the joints in between it will start to atrophy, will start to form bone spurs, right? So by the time they come in, wow, it's quite bad. Okay, so similarly, somebody will come in and say, oh, I got a knee problem. And then ask them how long, oh, 10 over years. We look at X-ray, wow, your cartilage is gone and so on, right? And cartilage don't go away by just weeks. Been there for years and rubbing abnormally and grinding it, and that's where it starts to break down over time, right? So if those patient comes, right, after many years of damage, okay, right, under constant loading and grinding and damage, right, there isn't a lot, it's not going to be reversible 100%. Okay, right? There's
even with surgery?
Follow me? So the knee, yes, then you do a total knee replacement. Okay, for the disc of the neck or the low back, you have to take you put now you got a carbon disc or a titanium disc, right? You got a disc bulge, you cut it off. When you cut it off, while the disc is pushing enough, you cut it off. Now you weaken the disc further. So over a few years, it becomes worse. Okay, problem will occur again, right? So surgery is not just, a lot of people think it's okay lah, and most I go for surgery, right? The most important thing is early detection. Go for early evaluation. Don't ignore it. Don't just put salumpas, and rub ointment and ignore it. Okay, and then month after month, years after months, it becomes worse and worse. Symptoms will be more chronic, right? More severe, and start to get numbness, right? Imagine a patient comes to me and say, doc, I started feeling numbness on my finger, just started 2 weeks ago. So my problem should be just 2 weeks ago. I say, no. For the numbness to appear 2 weeks ago, your problem will have been there for already 5 to 10 years of breaking down. And at the final stage, when you touch the nerve, then you start to have your tingling and numbness.
So what can we do to prevent this, Dr. Khan?
Prevention. Prevention is literally, right? So it's always important when you have an injury, rectify it, don't ignore it. Small injury is important, so check and adjust. So that's why in our site circle of patient, right? A lot of our patient knows that, and they will bring the children in and say, well, my children, I want to make sure my children is checked. Yeah, my kids will fall and so on. I do not want to wait until the condition or the symptom comes, because a lot of misalignment, right, have what we call silent symptoms, right? So they say check and adjust. So there's prevention. Check and adjust, correct it before it becomes a problem. Make sure their spine and nervous system is functioning well. So that's prevention. So if you have early problems, correct it and reverse it. Okay, don't wait until it's too late, then come for help. Right? Yes, when you come for help, we will still try to reverse you as much as possible, but there may be permanent deformity and permanent damage that we cannot help change anymore. right? So what do? Do we still not work with you? We still work with you. We reverse as much as possible. And then after that, we need to maintain a weakened joint. I've got a patient that comes in to check the neck, okay, right? Almost every week, every 2 weeks, almost. Why? Because if he stops coming for longer than about 3-4 weeks, right, the sense of taste will go away. So he said, I want my taste to be there, right? Follow me? So that is maintenance, okay?
So how effective is the chiropractic treatment, and on average, how many sessions does a patient needs before he sees improvement?
All right. How effective it is? We work, right, on the root of the problem, okay? Right. So is it effective? Yes. If your problem is from the spine. So that's why when we evaluate our patient, we want to make sure your problem is from the spine. And if your problem is from the spine, we are the professionals. We are the group of people that is qualified, right, to help with. So is it effective? Definitely. But if your problem is not from the spine, then we have to lead you to somewhere else. So we need to identify, right? So how effective? Very effective. If your problem is from the spine and it's from the root of what we look at, okay? Then the next question is how frequent, how long, okay, right? Then we should ask those questions, right? What are your problems? How bad? So for young kids that comes in, okay, right, and we expect the problem to be very early, simple. One of my first few patients when I first started, okay, happened to be, right, a niece of one of the ministers, okay, came in, right, and she was brought in. She's about, I think, about 6-7 months, okay, right, cannot twist the neck, right. It was a traumatic birth. The eyes are small, literally cannot cry all the time, okay. So we calculated that yes, it was a birth trauma, okay, and we adjusted the upper neck and the shoulder, okay, and it took us about, we adjusted 3 times a week for about a month or 2, okay? But every week you see the changes every week. Even after the first adjustment, the baby start to sleep. Before that, it's like difficult sleeping, just cry and tear and not eating. So within the first week, it was a major change, okay? I've seen a child with after 1.5 years old child with a whole skull that is singing, literally singing. Again, birth trauma, but it takes us a while to remodel it, okay? Frequently, yes, 3 times a week to remodel. So it depends on, right, the person, what type of problems, okay, right, and we work, okay, right, according to the root of that problem, okay. Now, but unfortunately, most of the adults comes in, right. I say unfortunately, and most, why? The problem has been there for years, okay. So how do we know, okay, right? And some of them came in. I've been to another chiropractor, I've been to another places. Oh, they only tell us a few visits to do, but it never works. I say, yeah, were there any X-ray done? Were there any evaluation? Okay, so we'll take an X-ray, we show up, and then we show up. Wow, and they say, I didn't know it's so bad. Okay, so then we start to really ask questions. So what can we do? How much can we do? How frequently do we need to work on this to try to reverse as much as possible? Okay, and then after that, what do we need to do to hold it, right, in place, despite still crooked, but hold it in place so that it doesn't collapse more, so that the nerve is not pressed, so that all your symptoms start to change and you have better quality of life, but it's still a weakened area. So we need regards, right? That's what we call intensive work, intensive remodeling work that takes anything 3 times a week for a few months. Then we graduate into 2 times a week and once a week. Okay, and then maintenance could be once a week or once every or twice a month. I mean, once every 2 weeks, maintaining that person.
Let's talk on scoliosis. Can you tell us what it is actually and what causes it?
Right, scoliosis. Scoliosis is curvature of the spine. Okay, and usually it starts from a young age. And once you have misalignment of the spine and the spine tries to grow, right? Okay, to grow out, especially in the growth spurt, right? For female, growth spurt starts about anything from 7-8 years old. Okay, they start to grow already, right? And they finish about 15 years old, okay, usually, okay? For males, guys will start about anything 10 to 12 years old, and then they grow into 18 years old. So during the growth spurt is very important. Once you have a misaligned at the low back and pelvic, okay, right, the spine start to grow crooked, okay? I'd like to give an example. It's like, you know, putting a young plant in a glass case, and the top of the glass case is a bit heavy, okay? And the plant is growing, right? And the plant needs to grow, and the tip of it, the top of it touches the glass top, and then you need to grow further. You got to push the lid up, and the lid is made out of glass, so it's a bit heavy. So imagine the plant is straight, it starts to become thicker and thicker and has strength to push the glass up, the lid up. But what happens if the plant at the base of somewhere, right, I introduce a kink and crookedness and rotate it, guess what? It will not have strength to push up. It will go around, circle, and it will bend. That's what scoliosis is about. Okay. So as a child with a misalignment and you don't take care of it, it will grow crooked.
So, Dr. Khan, is it curable?
It is at an early stage, yes. We have
okay, for an adult who comes in very late?
Adult is different already, right? Adult scoliosis usually, right? We ask them, they say, oh yeah, as a kid, you know, I know I have a scoliosis, right? And, you know, and I've been living with it. So most of the time I've got just low back stiff ache, okay, right? And they come in their 30s, right? And yeah, I've got scoliosis, and 20s. Can we reverse that? No, we cannot. We can only improve it probably. So depending on the degrees of the scoliosis, right? Anything below 45, if you are in the 20s and lower, the 18s, yes, we can improve the scoliosis. Okay, we can reduce the curvature even in adults. Okay, we can improve it. Of course, in children, we can improve it much faster, better.
Okay.
Right. And we also have procedure. We have a special bracing for it too. Okay. So for adult, we can improve it. Once you hit 45 degrees, it's very difficult to change. Okay. Right. And so we want to identify the first thing, right? In scoliosis management, the first criteria is identify it and try to stop it from getting worse. That's the first step. And then the second step is try to reverse it. Okay, follow me? Or the first step is stop it, slow it down, and reverse it. So there are actually 3 steps. A scoliosis under growth period can increase by tens of degrees within 3 to 6 months. Okay, and this is a proven fact. Yeah. For adult, we don't expect the adult to be going bad very badly unless, right, the triggering area or the vertebra that is in question is under compromise. Then it will become worse. Okay, so usually, right, it doesn't become worse very badly, right? And we want to reduce it. So adult, possibly we can change by 5 degrees, 8 degrees, 10 degrees. That's possibly, okay, for adult. Now, when the adults start to turn 60 years old, it's a different problem. With the scoliosis and osteoporosis start to form, right? When you have a scoliosis, means your vertebra is not, right, one on top of each other. It's not loading evenly. It's uneven. Okay, it's uneven. Means that a certain part of the vertebra is having a lot more, 90% of the tension compared to the right side. So under osteoporotic, you collapse. So we call it osteoporotic, right? Osteoporosis, right? Collapse of the vertebra, literally compression fracture. And because she's in a certain age, like 70, right? No orthopedic surgeon is going to operate because it's osteoporotic. Okay, they cannot cut anything. When they drill, it will break in pieces, right? So what happened? Then we do certain bracing to hold, okay, right? And that helps to reduce the pain, helps to return mobility, okay? And yes, you have scoliosis in children, right? Adults and elderly that we need to work with.
Dr. Khan, as a final question, anything else you want to share as a chiropractor?
I want to highlight to the general public that guys, our spine and nervous system is very important. If you give us all the children in, just say in KL, all the children in KL, right, from early age to age 18, and let us check and adjust them. I do not need to have condition, no pain, but check and adjust them, check their spine, making sure it's functioning well. If there's misalignment, we adjust. And for the next 30 years, just let us work with them, and you see, in 30 years, 18 years old become 48, and you look at the integrity of the spine, you will see them, wow, I don't see a lot of aging, I don't see a lot of damages, aging, and so on, right? And that's what we call healthy spine, and that is preventive lifestyle. So that's what I hope to do, okay?
All right. Thank you, Matt, for taking the time to be on our show. I'm Sharon.
Thank you, Sharon.
I have been speaking to Dr. Matt Khan, founder, senior consultant, and CEO of Chiropractic First Group of Clinics. This video will be on our Facebook and LinkedIn site, as well as on our website, www.biztech.asia. Please check out our website for more business and technology conversations.